Once again, good morning. Myself is Professor Dr. Rajendra Deshpande. We are in the Ayurved College, Nigdi, Pradhikaran, Pune 44. With me are the students of postgraduate students, that means who are doing the MD in Kriya Sharira, that is Ayurvedic Physiology. Today is a Thursday, that is 31st of May 2018. And today we would like to discuss the Ayurvedic aspect regarding the endocrine system in general and hyperthyroidism and hypothyroidism in specific. Because in the last lecture we have already talked about what are the clinical features of the hyperthyroidism, what are the clinical features of hypothyroidism. So keeping that views of modern physiology in mind or modern medicine in mind, we have also seen the treatment, modern treatment, but today we will concentrate on Ayurvedic approach. So in short, the title of this lecture can be said that Ayurvedic management of hyperthyroidism and hypothyroidism. Because many times there are limitations to treat this type of the patients with modern medicine. Of course, modern medicines are good, they are acting well, but sometimes there is resistance and some side effects are there or some dose has to be increased. So for that matter, Ayurvedic management will be definitely helpful for adjuvant, or sometimes it can be replaced by modern, that means modern medicine can be replaced by Ayurvedic medicines. Now regarding the thyroid gland, I have already told you that T3, T4 hormones are basically related with metabolic processes. And whenever we say it's a metabolism, it includes the two parts. One is the anabolism and second is a catabolism. So it's a conversion, that means the body molecules are converted from one thing to the another. So for example, if the amino acids are converted to the muscle proteins, that is called as a anabolism. And if my muscles are degraded and amino acids are released from that muscles, that is called as a catabolism. So when this transformation process is excessively stimulated, then hyperthyroidism takes place. And if this metabolic process goes down, that called as a hypothyroidism. According to Ayurveda, any transformation, any change, any digestion, any metabolism is the function of Agni. This is a specific concept of Ayurveda. That Ayurveda says that Agni is the principle which is responsible for any type of conversion. So it can be compared with many things. Agni concept can be compared with modern physiology in many aspects. Suppose for example, I am talking about simple primary digestion in the abdomen, where we are eating the gahu, wheats and rice and all these chapatis and rice, and it is transferred from the stomach to the jejunum or the ileum, and conversion taking place. Carbohydrates are converted to the glucose, proteins are converted to amino acids, and fats are converted to fatty acids. So this primary digestion, if we think about, then what is their Agni? That all the hydrochloric acid, all the enzymes, all the juices that are secreted from the stomach, from the small intestine are included as a Agni concept in Ayurveda. If you consider about the rhodopsin in the eye, so that particular hormone, or rather I can say enzyme, working at the rods and cones, it is also a type of the Agni, which Ayurveda called as a Alochak Pitta. So Agni is the principle or the energy which requires some media, and Agni is working through the media of Pitta dosha in Ayurveda. Agni principle, Agni energy is acting through the media of the Pitta dosha. For understanding purpose of modern doctors, you can say, for example, in this particular room where we have said electricity is there. We cannot see the electricity right now, but we can see the fans are there, we can see the lights are on, we can see the AC is on. So this electricity is working through the media of tube light, fan and air condition. Is it clear? So electricity has a media of the tube light. Agni has a media of the Pitta dosha. So it's very clear idea that Agni directly we cannot pursue, but its effects are definitely seen through the Pitta dosha. There are different types of the Pitta dosha, as you know very well: Pachaka, Ranjaka, Sadhaka, Bhrajaka and Alochaka. These are the 5 main types of the Pitta dosha. Why I am describing all these Agni and Pitta concept? Because when you talk about endocrine system and especially about the thyroid hormones are meant for proper conversion, proper metabolism of the body. Basal metabolic rate is depend on thyroid hormone. In hyperthyroidism, there is an increase in metabolic processes. BMR is increased. So according to Ayurvedic language, what you can say? There is an increase of Agni principle or the Pitta dosha in specific. Agni and Pitta are increased in hyperthyroidism because metabolism is increased. Here again comes the another important aspect of Ayurveda. What Ayurveda says, I am giving you the lecture as if I am giving the lecture to the modern doctors. Because if I start speaking only in the Ayurvedic language, that modern doctors will not understand each and everything. And if I going to only Ayurvedic language or only modern language, that cannot have the connection with the Ayurveda. So I am integrating both the things. For example, I have talked to you that Agni is the main concept in understanding the thyroid hormone. And especially hyperthyroidism, there is a Pitta is increased. Pitta dosha. Try to understand Pitta dosha, Pitta bioenergy, having the properties, main properties are Ushna and Tikshna. Ushna and Tikshna. Hot and penetrating. If somebody wants to know what is the original Sanskrit shloka or the verse for the properties of Pitta, Pittam Sasneha Tikshna Ushna Laghu. Laghu is a light, Vistra, Sara and Drava. The main properties for the transformation, for the metabolism is of course Ushna and Tikshna. It is very clear. Now another factor, important factor is, Ayurveda says there are 3 bioenergies in our body: Vata, Pitta and Kapha. Vata is the principle of movement, each and every movement in our body. Gross movement as well as subtle movements. If I am moving my hands and legs, it is because of the Vata according to Ayurveda. If my heart is beating, lub dub, what is the reason? Vata is there. If I am having the normal respiration 14 to 16 per minute, who is responsible for my ventilation, movement of the diaphragm, movement of the respiratory muscles? Vata principle is responsible. Pitta is the principle regarding the digestion or the transformation. So, Pitta is the principle for the transformation, digestion, metabolism, and Kapha is the bioenergy or the Kapha dosha is a principle for growth, mainly growth. Then stability, maintenance, union, all these are functions are given to the Kapha dosha, which are done with the properties like Shita, cold. Whenever there is a cooling principle, always it keeps the body going on. There is a less possibility of degeneration. In the cold countries, there is a less degeneration process, and that we are following in our day-to-day life. For example, when we want that decay should be prolonged of vegetables, if I bring the vegetables from the market and I want that they should be preserved for a longer time, what I will do? I will keep in a freeze. Here you can understand Ayurvedic principle. Why we are keeping? Because Ayurveda believes that cooling principle, Kapha dosha, is preventing the degeneration. It's for the nutrition, it's for the stability. So in hyperthyroidism, Pitta dosha is more. In hypothyroidism, as basal metabolic rate is low, Kapha dosha is in predominance. Try to understand. In hyperthyroidism, thyrotoxicosis, Pitta is a predominant. In hypomyxedema, Kapha dosha is a predominant. But here is a specific theme that you must understand. Ayurveda believes that Pitta and Kapha, they always need a support from Vata dosh. So Vata dosh many times act as a catalyst. Vata dosh many times acts as a catalyst. If anybody is interested to hear the original Sanskrit verse or shloka, Pitta Pangu, Kapha Pangu, Pangavo Maladhatavaha, Vayuna Yatra Niyante, Tatra Varshati Meghavat. This is the Sanskrit verse, but meaning is very simple, that Pitta and Kapha by themselves are handicapped or dependent. Dependent on what? Dependent from the energy from Vata dosha. Unless and until your hypothalamus, pituitary, thyroid axis, try to understand, hypothalamus, pituitary and thyroid axis conduction will not be there, what is the use of your hormones? So conduction is always going towards the Vata dosha. It may be the neuronal conduction, it may be the chemical conduction, it may be the physical conduction. Any movement, any conduction is because of the Vata dosha. So naturally, in hyperthyroidism, not only Pitta, but Vata and Pitta together will be the main culprit for the pathogenesis of hyperthyroidism. For Ayurvedic word for pathogenesis is samprapti. In samprapti or the pathogenesis of hyperthyroidism, Vata, Pitta together, these both the doshas are responsible. And just try to compare on the both the sides. In hypothyroidism, in pathogenesis, in the samprapti, which will be the dosha? Not only kapha. Vata and kapha together will be responsible. Do you understand the total philosophy behind that? Then when we talk about the dusha, what is meant by dusha in Ayurveda? Dushas are the victims. Whenever the doshas are provocated, vitiated, Vata prakop, Ayurvedic word, Pitta prakop, Kapha prakop, that vitiation is not keeping by themselves. They attack on the weaker tissues of the body. They attack on the weaker tissues on the body. And when we talk about this thyroid hormone, it is circulated through Rasa Rakta together. Ayurveda believes that Rasa and Rakta, both the dhatus are moving together, not separately. Plasma and blood cells, they are moving together. So naturally, the affected part is mainly Rasa, then Rakta, and as it is concerned with metabolic process, body mass, weight loss or weight gain and weight loss, that is naturally related with the Maus Dhatu. Maus Dhatu is mainly responsible for your weight loss as well as the weight gain. Weight loss and weight gain, is it clear? So naturally in hyperthyroidism there is a weight loss. So Maus Dhatu, Kshaya will be there. Deficiency of Maus Dhatu. In hypothyroidism there will be weight gain. So Kapha dosh is there, okay. But in addition to the Rasa and Rakta, there will be again Mausa Dusha. Mausa Vruddhi will be there. Mausa Kshaya, Mausa Vruddhi. So we have talked about Dosha, we have talked about Dusha. As I have already told you, the main factor which is responsible for pathogenesis is Agni. And in hyperthyroidism, Agni is not in a homeostasis phase. It is working abnormally high. Try to understand. And when it is working abnormally high, it is also Ayurveda called it as a Tikshna Agni. Tikshna Agni is a physiological as well as Tikshna Agni is pathological. So Agni Vruddhi will be there, but that is not physiological. Genetically, when we decide the Prakriti or the biotype, Pitta dosha is predominant, that makes the Agni Tikshna Agni. Kapha dosha is predominant, that makes the Agni Mandagni. But that at a physiological level. That will do not make any harm to the people. But this is, in the hyperthyroidism patient, the Agni is too much, TOO. That is also called as a pathological Tikshna Agni. Remember the word, pathological tikshna Agni, hyper functioning of Agni. It is burning to your body. It is destroying, making ash of your many body elements. Destructing, degeneration will be there in hyperthyroidism. These hyper and hypo conditions are like the two poles, north pole and the south pole. So many conditions are understandable with the simultaneous comparison. What will be in the hypothyroidism? Agni function is on the lower side. So that is a pathological mandagni. In the hypothyroidism or myxedema patient, there will be mandagni but in a pathological level, not genetically level. This must be understood. Then, as you understand, Ayurveda also believes on the Srotasa concept. Srotasa. Actually, you can understand that as it is concerned with the metabolism of all the cells, thyroid glands are acting on each and every cell of your body. So naturally, all the Srotasas are included in the pathogenesis. But you might have been remembering Samanya Sroto Dushti Lakshane. What are those? What are Samanya Sroto Dushti Lakshana? Srotasas mean the micro and macro channels of your body. And in that particular channels, different body elements are metabolized. Like Rasava Srotas, Raktava Srotas, Mausava Srotas, Asthива Srotas. In all these Srotasas, homeostasis is maintained. But when the metabolism is stimulated, then which are the concept? Ati pravrutti sangova siranam granthayopi va vimarga gamanam chapi srotasam dushti lakshanam. Is Sanskrit word, but the simple meaning is in English that either there may be hyperactivity of that channel, hyperactivity, basal metabolic rate is increased. So that is a hyperactivity which is called as a ati pravrutti of that particular srotasa. Hyper functioning is ati pravrutti, and in hypo it is totally opposite again. It is a hypo functioning, that is sanga, obstruction. There will be constipation. Different body elements will not be formed well. There will be less muscles, less fat, less bones. So that constituent is not well formed. Why? Because there is obstructions in the passages. And here it is a hyper functioning of Srotasas, ati pravrutti. And last point is regarding the Ayurveda says that how much that disease is spread. So it is called as Abhyantara Roga Marga, Bahya Roga Marga and Madhyama Roga Marga. This is the Ayurvedic concept. When your pathogenesis is restricted to the GI tract, basically GI tract, then naturally it is concerned with the Abhyantara Roga Marga, internal channel for the process of disease, for the pathogenesis. For example, diarrhea, very simple, vomiting, chardi. These are Abhyantara Vyadhis which are restricted to the GI tract majority. Then there is a Bahya Marga. When that pathogenesis spread to the extremities, that is called as a Bahya Marga. So pathogenesis is spreading in the bones, in the skin. Do you understand? That is becomes the Bahya Roga Marga. And when the pathogenesis is spreading in major vital important organs like brain, kidney, heart, liver, then that is called as a Madhyama Roga Marga. It is very serious. Pathogenesis has been spread to the deepest tissue of your body. So that is called as a Madhyama Roga Marga. So these Roga Margas are depend in which areas that pathogenesis has been restricted. So what you will talk about the hyper and hypothyroidism? As I am repeatedly telling you that these particular thyroid hormones are acting on each and every cell. So they are acting on GI tract, they are acting on the muscles, they are acting on the skin, they are acting on the brain. So what is there? All the Roga Margas are affected in hyperthyroidism and hypothyroidism. All the Margas, Koshta, Shakha and Marma. Now next we will talk about which are the particular properties are disturbed. First we will talk about hyperthyroidism. Vata dosha is there, okay, in pathogenesis. Pitta dosha is there, okay. But basically, because of the excessive burning, excessive fire, which gunas can cause particular pathogenesis? So that understanding of deeper knowledge, of deeper understanding of pathogenesis, this particular concept has been explained by the word in Ayurveda, anshansha kalpana. Try to understand. Anshansha kalpana. How to examine the patient? Dashavidha pariksha. Ayurveda has said, dusham, desham, balam, kalam, analam prakritim vayaha, satvam, satmyam, tatha aharam, avasthascha pruthagvidaha. To understand the disease, it is not only important to understand only dosha, but one must understand dosha has many properties. So which exactly properties is involved in the process of hyperthyroidism? So whenever there is excessive fire, excessive heat in the body, excessive metabolism is there, all your body tissues are degenerating, are burnt up. Pitta dosha is with the Ushna and Tikshna property. Ushna and Tikshna property. These are degenerating properties. Destroy your body elements. And about the Vata dosha, which are the normal physiological gunas of Vata dosha, Tatra, Ruksho, Lagu, Shitaha, Khar, Sukshmaschalo Nilaha. But here, only we have to consider the Ruksha guna, which is for catabolism. Try to understand. Ruksha guna is for catabolism. Vata dosha has a Ruksha as well as Shita. But here, Shita has no role. Here, Shita dosha is not disturbed. Which dosha is disturbed? Ruksha and Laghu and Chala. Write down these three words. Ruksha, Laghu and Chala. They are in hyper state, excessive, and so they are destroying your body. Ruksha, dry. Laghu is a lightness and Chala is a excessive movement. Ati pravrutti. Do you understand? Excessive nerve conduction, excessive stimulation. Modern physiology, they said that there are immunoglobulins or the antibodies are formed which stimulate the thyroid gland. So this excessive stimulation is nothing but the Chala guna of Vata dosha. And for the Pitta, Pittam Sasne Tikshnoshnam Laghu Vistram Saram Dravam, mainly Ushna Tikshna, but there is also the Chala guna. Because Chala is in Vat, Chala is also in the Pitta. Pittam Sasne Tikshnoshnam Laghu. Laghu guna is very important. I am sorry. Pitta, Laghu guna is important. Because it is degenerated principle. Laghu makes your body less. Guru makes your body improved or increased. Guru guna is a nourishing. Do you understand? And Laghu guna is a degenerating. Laghu means light. Why we have to consider these properties? Because when we have to management of hyperthyroidism, we have to understand these properties and then we have to find out which are the causes that makes your body Ushna, Tikshna, Laghu, Ruksha and Chala. Do you understand? This is Anshansha Kalpana. Forget about what the causes that modern physiologist has mentioned. But if you want to practice Ayurveda, you must find out the basic cause on the basis of properties. On the basis of properties. I will explain one by one. Because Ayurvedic management has 6 steps. Try to understand. 6 steps in management. Any disease can be managed in 6 steps. Very important concept. No book has given this serially. But when I practiced and when I teach, always teach that you should make any disease management on these 6 points line. What are number first? Remove the cause. Try to nullify the cause. As much as possible, get away from the cause. In Ayurveda it is mentioned in Sanskrit, Sankhepataha, Kriya Yogo, Nidana Parivarjanam. Sankhepataha, Kriya Yogo, Nidana Parivarjanam. That means in English translation, in short, what is the medicine? What is the treatment? Treatment means to remove the cause. This is the first step. If you are treating the cold, if you are treating the cancer, this step will be there. Sankshepata kriyayogo nidana parivarjanam means to control the causative factors. As much as possible, you control the causative factors. Number 2 is called as reset your lifestyle. Reset. That means whichever the defects or the faults or the errors that you are seeing in your diet, that you are seeing in your lifestyle, you correct it. Otherwise, whatever you do, that will not be helpful. So in Ayurveda, it is called as a do's and don'ts. Do's and don'ts, that is pathya pathya kalpana. Pathya means you do it, and apathya means you don't do it. This is very important, pathya pathya kalpana. You know also the Sanskrit shlok, pathya sati gadartasya aushadam nishevanam kim. If you follow the pathya, if you follow the doctor's advice, there is no need of medicine. And second line is telling you, if you don't follow it, what is the use of taking medicine? That much is the importance in our management of any disease regarding the pathya pathya. So you must convince the patient that whatever I am giving you advice about diet or the lifestyle, you must follow it. Then only my medicines will work. Third point in treatment. You have to decide whether the doshas are in utkatavastha, utklishta, extremely provocated. That means they are so much so disturbed, this vata pitta kapha, they themselves want to come out of your body. That means, for example, some patient has such a acidity, such a headache with the acidity, that he gets nausea, sometimes vomiting. And the patient tells you that, doctor, if I get the vomiting, then immediately I feel better. That is called as the utkat avastha in Ayurveda, utklishta. So for these people, when the doshas are extremely provocated, there is extreme toxins in your body, first do the shodhana karma. There is no alternative for doing the shodhana karma. Unless and until you clean your body from ama, that is toxins, it's called as am in Ayurveda. If you clean your vata pitta kapha, if you clean your sapta dhatus, if you clean your malas, then only next treatment, that is palliative treatment, will be applied or will be useful. If you don't do the shodhana at a proper time or in a proper patient, then there is no use of the shamana chikitsa. Of course, it has to be decided whether in which patient which karma should be there, but shodhana karma has a third place in our management. Fourth place, after shodhana karma, or if the patient is totally contraindicated for shodhana, then you can directly go on the fourth step, that is called as a shamana chikitsa, palliative treatment to make balance of dosha dhatu mala by giving some medicines, internal medicines or external applications. That is called as shamana. So once again I repeat, first step in management, remove the cause or control the causes. Number 2, pathya pathya. Number 3, shodhana. Number 4, shamana. Number 5, if the patient is indicated for surgery, that physician should know where there is a necessity of surgery. If it is a toxic goiter, nodular goiter, multiple nodes are there, then there may be necessary to remove the thyroid gland. If your chemotherapy fails, if your radiotherapy fails, naturally what physicians are doing? They are referring to the surgeon. Ayurveda has also mentioned the same thing. Ayurveda says sometimes tatra dhanvantariyanam adhikaraha. What is the phrase? Tatra dhanvantariyanam adhikaraha. That means at some places, sometimes you must refer the patient to the surgeon. This is the 5th step of management. And last step is called as apunarbhava chikitsa. Apunarbhava chikitsa, that means rasayana treatment apunarbhava. Rasayana treatment, that means you have to give the nutritive tonics for the weaker dhatus or weaker tissues in your body. You have to give the immunomodulators to build up your immunity to avoid what? To avoid recurrence. To avoid recurrence and to reduce the intensity of the disease. So this is the sixth step in your management program. So RRD always recommends, whenever you want to write any treatment plan for any disease, go with this policy. Write down the 6 steps, and for each step you have to describe something. I hope this is new thing and you have understood whatever I have mentioned about the 6 steps. Is it clear? Then we will talk about the hyperthyroidism, which are the basic principles of management. As we have said, it is a Vata Pitta problem. We have to balance the Vata and Pitta dosh in your body. Number 2, as Tikshnagni is there, we have to balance Agni, metabolic process. As there is a Dhatu Pak, that is excessive degeneration, excessive catabolism, we have to give the nourishing treatment to all tissues. Nourishing treatment to all the tissues. That means the Rasayana in Ayurveda, whichever the dhatus, especially Rasa, Rakta and Mamsa, we have to give the nutritive or Bruhana treatment. So whenever there is a degeneration of many tissues or overall body is affected, Ayurveda says that is the problem of Oj. And when many cells of your body are affected, you have to give the Ojo Vardhana treatment. Immunity building treatment. It is called in Ayurveda Oja Vardhana. Improve your quality of all the tissues and make your immunity stronger or strongest. That is called as Ojo Vardhana Chikitsa. Now you tell me, we have already discussed that which are the properties of Pitta and Vata are affecting hyperthyroidism. For example, Ushna and Tikshna. So what you will find and what you will advise the patient? If the patient is of Pitta Prakriti, from the very beginning he has to control his diet. Or any hyperthyroidism patient should not eat the spicy food. This statement is not written in any single book available in the market of any author. But this is the principle. You have to search out whether the patient is all the time eating any chili or the spicy food, because Ushna Tikshna Guni will be suffered. Secondly, whether he is having any vices, VICES, that is addictions. For example, smoking, tobacco and alcohol, these are the 3 main addictions or the vices, VICES. All these addictions, what are the properties? What will they make your body? Hot, and heat will be generated. So any వ్యసన is there, any addiction is there, you must stop that addiction. Stop alcohol, stop smoking, stop tobacco. You will not find again this statement in the treatment of hyperthyroidism in any Ayurvedic or any modern book. This is the new thing that I am giving at this period. Ushna Tikshna Gun. So all the vices are bad for this person. Then keeping late at night. That means going at the bed in the midnight. After midnight. That is very bad for the hyperthyroidism. That will increase Ushna, Tikshna, Laghu and also Ruksha Guna. Is it clear? So keeping late at night is also very bad. Then what else can you say about Chalaguna? If the person is having a job or his lifestyle too fast, TOO, too aggressive, too fast, that will be problematic for this hyperthyroidism. He must balance his lifestyle. Slow and steady will be the principle for hyperthyroidism. Slow and steady is the best treatment, best lifestyle for hyperthyroidism. If he keep himself always running here and there, lot of burden of the physical and mental work, and naturally whenever there is excessive mental stress, it is called as stress management. So for hyperthyroidism, you must give the stress management treatment. Stress management treatment, very easy. There you can give counseling as well as yoga management. You can advise him simple techniques like meditation, doing the shavasana. This will be the best thing for the hyperthyroidism. That will cool down his body systems and ati pravrutti will be slowed down. I always in the foreign countries I teach the people to follow the rule of 8. This is the word developed by R.R. Deshpande, Professor Deshpande. Rule of 8. What is that rule of 8? You divide your 24 hours in 8 hours each. So 8 hours for your daily routine, for maintaining your bread and butter. 8 hours for the sleep or the rest. I am not saying you must go on the bed, but 8 hours should be the rest phase, including your sleep. And 8 hours for your daily rituals. For example, eating, toilets, washing, keeping yourself. So 8 hours working as your profession as a bread and butter, 8 hours for sleep, and 8 hours for you, your family, for the society, and for your own recreation. So this is called as rule of 8. Division of 24 hours in 8 hours, 3 parts. Rule of 8. This word is coined by Professor Deshpande in nationally and international level. So everybody, hyperthyroidism patient must follow the rule of 8. Then only his ruksha gun will be less, chala gun will be less, and tikshna and ushna gun will be less. Is it clear, this particular thing? Then there is a lot of things you can advise him, the lifestyle which he should follow as per the base of Pitta Pradhana Prakruti. His diet, especially for example, Punjabi dishes in India, they are very spicy. It should be avoided. He must eat something sweet daily. Hyperthyroidism patient, if he is not diabetic, then he should eat at least some sweet substances every day, especially the ghee and sugar is the best thing. Every day, ghee and sugar. Every day, a little bit milk with sugar. That is the best thing for hyperthyroidism patient. Then, there is a dryness. So, he must protect from the excessive sun and excessive wind. His body should be protected from excessive sun and excessive wind. And simple thing to protect from the ruksha guna or chala guna, simple, very, very gentle, full body oil massage is very good for hyperthyroidism. For hyperthyroidism patient, gentle, soft, full body massage with nourishing oil, especially cooling oils. Which are the best cooling oils? Chandana, Bala, Lakshadi, Taila. This oil should be used for hyperthyroidism patient. Chandana, Bala, Lakshadi, Taila. This is the name of the medicated oil. Or you can use Kshira, Bala, Taila. Kshira means milk. Bala is a nourishing plant. Kshira, Bala, Taila. There are so many oils. One of the third one is a Bala Guduchadi oil. Bala Guduchadi. Guduchi is a Tinospora cordifolia, anti-pitta. Then very costly, but if we can bear, Chandanadi Taila. From the sandalwood. But at least for the hands, feet and vertex of your head, you must try to put this Chandanadi oil for hyperthyroidism. So we have discussed the first 2 points about the causes and about the Patyapatya. Now we will go for Panchakarma. As this disease is predominantly of Pitta dosha, what is the best Panchakarma or detox process? Virechan is on number 1. So the patient with proper snehana, this is most important. If proper snehana is not given, then Virechan can make him trouble. So proper snehan, compliance of the patient is very much essential. Ask the patient to take the ghee in front of you early in the morning as a Purva Karma. Purva Karma of Virechan. Virechana is a process of giving purgative drugs to the patient to remove the toxic pitta dosha from your body. Toxic pitta dosha or heat from your body. There are many things that you can use depending on the patient's strength. If the patient's strength is not too much, then in spite of going to the direct virechana, you can prescribe every day mrudu anulomana. Mrudu anulomana. For example, aragvadharishta every day. Or avipattikara churna every day. Every night I can say. Aragvadharishta is from the Cassia fistula bhava. 4 teaspoon of medicine and 4 teaspoon of water at night, or I am saying or avipattikara churna 10 gram with warm water at night. And if the patient is virechana, that means indicated, then you can give the purva karma snehana, lubrication with medicated ghee. 2 ghees you can use for hyperthyroidism. One is a Shatavari Ghrita, or second you can use is Darimadi Ghrita, and third you can use is Tiktaka Ghrita or Maha Tiktaka Ghrita as a Purva Karma, Purva Sneha Pana, and then you can use Virechana with the Trivrut Leha. Trivrut means Nishottar. Trivrut Leha, you can give 25 grams early in the morning with warm water. And if still the patient is indicated in spite of Trivrut, you can use the higher versions of purgative drugs. And the names of the higher versions are Ashwakanchuki tablet, 125 milligram, only one, or tablet Ichha Bhedi. Ashwakanchiki or Ichha Bhedi, only one tablet early in the morning. It will make some 10 to 15 loose motions in a day, but your body will be very, very purified. Then second thing, or the next panchakarma that you can use, or as this is related with the hypothalamus pituitary thyroid axis, that is urdhva jatrugata parts are there. Do you understand? Urdhva jatrugata. Ayurveda says, whenever the disease, whenever the problems are above the region of your clavicle bone or the shoulder bone, which includes ear, nose, throat, eyes and the brain. Now this is the problem of brain as well, because your hypothalamus, pituitary and thyroid, all the glands are in the brain region or in the upper part of your clavicle. So nasya is indicated because urdhva jatru vikareshu visheshat nasyam ishyate. This is a Sanskrit line. Urdhva jatrugata vikareshu visheshat nasyam ishyate. But here there are different types of the nasal medication, nasal drops. Here, as the process is degenerative, catabolism is more, metabolism is increased. So what you can do? Bruhana nasya. Bruhana nasya. That is nourishing nasal drops, nourishing to the hypothalamus, nourishing to the pituitary, nourishing to the brain cells. And that particular oil, Kshira Bala 21 Avarti. The name of the oil is Kshira Bala 21 Avarti. Avarti is a process. Processing was done, or rather processing is done 21 times. Then apart from actual panchakarma, you can use para panchakarma procedure. It is called as a para panchakarma. That means parallel procedures which help like the panchakarma to make your body homeostasis. As this is the brain problem, not exactly the brain problem, but brain related hypothalamus problem, nerve conduction or the endocrine control, you can use Shirodhara. By using Shirodhara, you can reduce the Chala Guna and Ruksha Guna of Vata dosh and Ushna Tikshna Guna of Pitta dosha. Shirodhara with Kshira Bala Taila, or Chandanadi Taila, sandalwood. This will make your all body systems cool and calm. Shirodhara means pouring oil on the head. It is a head shower of the oil, and it is many times very, very relaxing and very soothing to the brain. Brain is the chief control of all your body systems, or the motor and sensory main switches are in the brain. They are controlled by the Shirodhara. Even there is a one process which is called Shiropichu. So keeping the oil swab with Hima Sagar Taila. Hima Sagar Taila. Hima Sagar Taila. You have to keep the swab on the vertex and make a bandage on the head. Make a bandage on the head. So that will keep a more time. You can keep that bandage for 6 hours, again remove it, again keep. This way you can do the BD, this particular process. In whole day you can do 2 times this particular Shiro Pichu process. Pichu means swab. Shirodhara can be made, if anybody is interested to make a decoction, then there are Pitta Shamana Gana described in Ayurveda, which will cool down Pitta. Those group of the herbs are called as Nyagrodhadi Gana and Padmakadi Taila. Nyagrodhadi and Padmakadi Taila. Now I will directly go to the internal medicine. In the internal medicine, there are 3 or 4 types of the decoctions which are Pitta Shamaka, that can be used twice in a day. Shatavaryadi Kvatha. Shatavaryadi Kvatha is reducing the Pitta, controlling the excessive burning, Daha Shamak, and also controlling the Agni, Atyagni Nashana. Shatavaryadi Kvatha, 4 teaspoon of medicine, 4 teaspoon of water, twice in a day. Then Guluchadi decoction. Guluchadi is a Guduchi, remember, Amrutadi Kashaya. Amrutadi Kashaya or Bala Guduchadi Kashaya. Guduchi is Tinospora cordifolia and Bala is a Sida cordifolia. Bala is a Vata controlling and Guduchi is a Pitta controlling. Then in the morning and evening he can take Shatavari Kalpa, 1 teaspoon in a cup of milk. Shatavari Kalpa. Of course, not all the medicines one has to use all the time. You have to select the patient and according to indication you can select the drug. Third decoction is a Drakshadi decoction. It is also Vata Pitta Shamana, Daha Shamana, and it is also nourishing or nutriting. Next Kashaya is a Vidaryadi Kashaya. Vidaryadi Kashaya. But basically Vidari plant is very, very nourishing. So whenever there is a weight loss is severe, you can use this Vidaryadi Kashaya. Whenever in hyperthyroidism weight loss is more, use this Vidaryadi Kashaya. Next will be the Mahatiktaka Ghrita. Mahatiktaka Ghrita. Bitter taste is always Pitta pacification. Tiktaras is always good to clean the Pitta dosha, to pacify the Pitta. But as you know, Tiktaras is also dry. So to remove that dryness, we are making a preparation Mahatiktaka Ghrita. So Ghrita is controlling the Vata and also Ghrita is controlling the Pitta. So this is a very, what you can say, the very best combination, that we are taking the advantage of Tiktaras, but we are not getting disadvantage of Tikta, creating of dryness, because it is the Mahatiktaka Ghrita. So medicated ghee is indicated in hyperthyroidism. Then if you talk about single herbs, which single herbal tablets can be used as a rasayana, that means after controlling the symptoms for the next 3 months, 6 months or 1 year, you can prescribe tablet Shatavari Ghanavati, Shatavari Asparagus racemosus, one of the best plant for Pitta Shamana, removing the heat in our body. Second plant is Amalaki, from the Amala fruit, like Chavanaprasha also you can prescribe, is Pitta Shamak and nourishing to all the body tissues. Sapta Dhatu Rasayana. Sapta Dhatu Rasayana, which is Chavanaprasha, or tablet Amalaki Ghanavati. Amalaki Ghanavati. Then you can use the Ashwagandha, especially for muscles and bones, to make them stronger in hyperthyroidism. So it improves the Dhatu Sarata of Mausa and Med. Ashwagandha Ghanavati can be used. And Guduchi Ghanavati is there. Guduchi Ghanavati. But very interestingly, there is one tablet in the market which is called as two preparations, Rasayana Churna or Rasayana Churna Vati is also available. That Rasayana Churna is made up of all these four plants: Shatavari, Guduchi, Ashwagandha, Amalaki, and sometimes Gokshur is added. So this is called as one in all. What is that preparation? Rasayana Churna, or another name for that tablet. Remember that name. Ashwagandhadi Churnavati. What is the name I have said? Ashwagandhadi. Adi means etc. Ashwagandhadi Churnavati is a combination of all the four plants. And my dear friends, try to understand that Shatavari, Guduchi and Ashwagandha, these are proved as a immunomodulator drugs with even modern pharmacologists. Modern scientists from the pharmacology department, they have proved that Ashwagandha, Guduchi and Shatavari, they are immunomodulator. And disease, hyperthyroidism, is many times the problem of autoimmune disease. Remember this word, hyperthyroidism, autoimmune disease. We must increase the OJ. We must increase the Sapta Dhatu Sarata. Must improve the Vyadhik Kshamatva, immune power of the patient. So all the things that we have to use are the Balya, Bruhana, etc. So I hope that we have understood what is hyperthyroidism from the Ayurvedic perspective. We have discussed about the Vata Pitta Dosha, Rasarakta Mausa Dusha, Tikshnagni as Agni, Sroto Dushti is of Ati Pravrutti nature. The disease is from Koshta Shakha and Marmasti Sandhi, and which are the Anshansha or Vikalpa Samprapti. Ruksha and Chala property of Vata Dosh, Ushna, Tikshna and Lagu properties of Pitta Dosh are disturbed. So naturally our management should control the Vata Pitta. It should be Vata Pitta Shamana. Dhatu Pak we should prevent, and we should increase the Dhatu Sarata by Rasayan management or Ojo Vardhana Chikitsa. So there should be removal of the causative factors, Pathyapathya, do's and don'ts, Shodhana Chikitsa, Panchakarma, Shamana Chikitsa. Here, if necessary, you have to refer to the surgeon for nodular goiter, and lastly is the Rasayan Chikitsa, that also we have seen. So 6 steps of the management we have completed, and in the next lecture we may see the management of hypothyroidism. So thank you very much for patience hearing, and I wish you all the best. Thank you.